So waiting for Dr. Jonquille Chantrey. Süper. Yes, let's take her. Selam herkese. Oh, hi.
Hi.
Looking good.
So are you?
Glowy, glowy.
Well, yeah. I've been on high strength tretinoin. So I'm kind of glowy, but also peeling at the same
Oh,
time.
okay.
So
But
it's, you know
I
how
mean,
it is, Valerie.
across the live, you just look very glowy. So let me say that. It's we're so lucky to have you today here to talk about adult acne. But before we begin, I want to tell my followers a bit about who you are to introduce you a bit. So Dr. Jonquille Chantrey, whom I've met in Monaco last year at AMWC, like I said, it's basically a fair to discover the novelties in medical aesthetics and anti-aging. So basically what we all love. And I met her there. She was actually a key speaker. And I mean, she not just knows so much about it. And she's a surgeon. She's an international lecturer on beauty and aesthetics. And she's actually worked in 6 continents. Am I right?
I think so. Yeah, it's six or
Yeah.
seven consonants. Yeah.
Yeah. So she's traveled all over the world. And today she has said, okay, to discuss adult acne with you, as I know so many of you have been asking me questions about it. So welcome, doctor.
Thank you so much, Valerie. I really appreciate you asking me to join you because obviously since AMWC last year and we talked a lot about beauty trends and
Yeah.
what's happening worldwide and what's coming up. But did we expect something like this? My goodness,
No.
no. So when we were talking about what would be coming up in the next few years and how you know different interests and different areas, in terms of wellness, were impacting our industry. Did we realize this? No. So of course, this is having an impact on everybody who is
Yeah.
looking in, and skin health in particular is a really important factor when it comes to all of this. Um, as you know, my practice is based in Manchester. Well, it's just outside of Manchester in the UK. I also do some work in London. I do some advisory work for different brands, so brands such as Botox and Juvederm, which is obviously where
Yeah.
we met. Also with L'Oreal and with Zainab Arji. So I'm quite choice with who I work with. And I just really believe in working with the best products and the best scientifically proven products for my patients, and also for public education. So so in terms of my clinic work, I see really, really diverse patients. And I think because so much of my work is international,
Yeah.
I'm really fortunate in Manchester because we have an international airport. So I'm literally down the road from the airport, and we have
Yeah. I see you're always traveling. Yeah.
I am always traveling, and my patients travel to see me a lot into Manchester, as you know. And it's really broad demographic, so different skin types, different ethnicities, different cultural backgrounds, and of course different professional backgrounds. So I feel really, really fortunate, and I suppose my key interests are skin and aesthetics as a whole, both face and body. I've done a lot of body contouring over the years as well, and scarring. So facial deformity, some of the cases we discussed last year.
And actually, I've seen some of your before and afters during the presentation that you gave, and I saw some acne scarring before and after treatments, and it just blew my mind. Because when people think aesthetics, when they think medical aesthetics, they always think of like anti-aging, like automatically, but they kind of miss the point that there's so much that can be done when it's done right, even to the point that it can help treat acne scars, right?
Absolutely. And obviously, we're going to be talking a lot more about acne today and the chronic impact that has, which, of course, is the physical impact, but also the psychological impact. And those scars can be treated. There's lots of different types of scarring, but they can be treated. And scarring at large, irrelevant of the cause of it, be it traumatic or surgical, inflammation. There's lots of different causes, and there's it's a real area that I love to treat. So yeah, it's
Yeah.
important.
So I'm just gonna delve into my questions.
Okay.
So let's just talk about congestion. Like, let's go to the beginning of the problem. Like, how does congestion happen, and like, what are some things we can do during the day to prevent it?
Okay. So congestion. So how does it all start? So there's the hair follicle and the sebaceous gland, so the oil gland. And what happens is with the hair follicle, there's what we call a hyperproliferation. So there's a real increase in the production of the keratin within that hair follicle. That then builds up, and if it's not shed and the cell turnover is not shed appropriately and efficiently, then it gets plugged.
Okay.
And then there is an increase in inflammation.
Okay.
There's an increase in sebum and oil, and also there's an increase in the bacteria, which is a normal, what we call commensal of the skin that's normally found on the skin, called P. acnes. So that increases, and then that has an impact on the hair follicle.
So the whole thing with acne starts with the hair follicle.
Right. Yeah. So that relationship with the hair follicle and the sebaceous gland, the oil gland that's associated with it. And of course, we have an increased density of sebaceous glands in the face, the neck, the chest, and the back. So that's why there's an increased risk of congestion in those areas.
On the face and on the back.
Yeah, neck and the chest as well.
Okay, so I know that there are different types of adult acne, and there are certain types that people like doctors like you treat, and certain types that endocrinologists treat, like hormonal acne. So can you just elaborate a bit on different types of acne?
Sure. I mean, it's a really big subject, but if we kind of dial it down to real basics.
Yeah.
So you can have mild, moderate, and severe. So mild, whereby people might not even consider that they have acne. They'll say that they have the odd breakout around the time of the month or whatever, but that would still potentially come under the mild bracket. Okay. And then depending on the density, how much, how frequently, the severity of each one of those particular pustules, nodules, whatever, then it becomes moderate or up to severe. And you know, going back to what you said about congestion, you know, it starts with the comedone. So, you know, when you read in products where it says it's non-comedogenic. So, you know, you can have just the comedone form where it's blackheads and whiteheads. So there's a blockage there, and dependent on whether they're open or closed. And then there's types where there's papules, pustules, where there's like red areas around the breakouts, nodules that tend to be underneath the skin, and then cysts. So those latter ones tend to be more painful. They can be bigger. They can take a long time to resolve, and there's a much increased risk of scarring with things like that.
When should we decide like it's the right time to go see a doctor or like a dermatologist when we're having acne problems, you think?
Yeah, I think it first starts with thinking about what you're putting on your skin at home.
Yeah.
And what are the symptoms that you're having? So as somebody at home who might not necessarily want to present to a doctor straight away, those are the two things I'd like you to start to think about. So, you know, I talk about this a lot, but, you know, you go into the beauty halls and you're bombarded with all of these different products, all of these different options. And now, of course, online, you know, there's all these beauty hacks and influencers trying to sell something, and it's like, okay, well, I better try that then. And people are mixing lots of different inappropriate products that won't necessarily be right for their skin. So that's just one thing to consider. And then if you're getting breakouts more frequently that are starting to bother you, they're not resolving, it might be more frequently than just new onset areas, you know, where it's starting to leave scars and really bother you psychologically.
Just get annoying.
Yeah, they're all indications. And I really would like to help people get to the point before the scars start. So those are all indicators that, you know, maybe I should present, and other hormonal factors. So of course, acne treats all affects all genders, men and women. But in terms of women, what's happening with your periods? Have they stopped? Have they become irregular? Have they become heavier than usual? Are you getting other symptoms like increased hair in certain areas, pigmentation? Those may be showing that there's a more global systemic medical component to this, because hormones have a big part in acne, and that's a really important reason to present, because that might not just be about your skin, but other health factors as well.
So what's the skin problem? Like when we think it's a hormonal problem, like what's the right way to go about treating it? Is it like going to see a dermatologist, endocrinologist?
Yeah, so if we look back at acne and what are the causes of it, it's multifactorial. There's immune modulated aspects, and there's definitely big components in the data that shows that hormones most definitely play a part. So first port of call would always be to the primary doctor, so the healthcare physician, the family doctor. There's a lot of great doctors out there who really manage these patients well in the community, but there comes to a point where they need to be referred in, and depending on your primary care physician, they will have a threshold for how quickly they will refer you in or not, and whether or not you decide to go privately. So like I said, all of those hormonal symptoms for sure, and also with women, increased pelvic pain, other things related to that, I would definitely present. So in terms of who do you go to, if skin is bothering you more, I would probably go to the dermatologist route first. And the really great skin doctors and dermatologists will work closely with an endocrinologist who can then do the blood tests, and you may need an ultrasound scan, like a pelvic ultrasound scan. There's certain diagnostic criteria.
All right. Also, recently I've been getting a lot of messages from my followers and friends saying that they started experiencing adult acne problems since the beginning of the self-isolation. So I was thinking maybe it's stress related. It's not, being indoors related. And I wanted to ask you, how much is stress, affecting adult acne?
Yeah, that's such a great question. When we look at adult acne, it's now showing that it actually in women, it might be prevalent to up to about 22% of all women are being affected. That's actually a really big proportion. And, depending on the data you look at, it's around about the 8th most common disease in the world. So it's actually super common, and really high proportions of women, like 70% of women, report having breakouts at the time of the month. So this is becoming an increasingly more common problem with regards to this, and in association with this is stress is also increasing. So we know, because we're living in this constantly on lifestyle and we're always switched on, our bodies are so used to pumping out, our adrenal glands are so used to pumping out, the cortisol, etc., the adrenaline, and we're used to that level. So now that people are indoors more and they're feeling a loss of control over this situation, they're getting a more subliminal form of stress that they may not have had before. And there's clear data to show, this was really interesting, that stress increases a substance called substance P. And substance P has a direct impact on the oil glands. So it increases the activity of the oil glands directly. So there is a direct communication between the two.
Oh my God, that's like go into meditation, like alarm, It
is, it's true. And when you look at the acne data, a lot of the people who do complain of acne say that stress actually increases their acne, significantly. They'll actually document, a lot of my patients will document with diaries as to how their acne is affecting them throughout the year. And, they can really see those spikes in stress, and that's really common.
Yes. So we're getting some questions about the linkage of diets with acne, as well as, can Ayurvedic treatment cure adult acne? So, I mean, that was one of my later questions, but let's just go into that right now. Like,
Sure.
how much of what we eat affects our skin in terms of acne? Like, what should we eat and what should we avoid? So,
Yeah. So I think in general at the moment during this lockdown period, we should be attempting as much as we can to still get our nutrition from natural resources. And supplements are important and they may well be necessary, but try and get them from the the most natural
the food
resource.
itself,
So
yeah.
exactly. So key factors will be things like zinc. Vitamin D has been shown to be very important at the moment in terms of COVID-19. And with regards to acne, it was a question that I actually had when I put out the questions with regards to diet was, is there actually a link between sugar and dairy?
Yes.
So some people aren't aware of it. People think that actually I didn't know that there was potentially a link. So the question to me was, is there a scientific link? And there is. So with high glycemic type foods, obviously the ones that cause that spike in blood sugar, that then has an impact on insulin levels and something called IG1. So that then has an impact on the oil glands themselves. And again, this has been shown in multiple studies to actually impact. So, and we've seen it in other forms, with eczema as well and other skin disorders, but there's a definite and direct link between high glycemic foods and dairy and acne. So yeah, for sure, try and cut those down, which is hard because our adrenal glands at the moment and our cortisol levels are making us want to have more carbs and, more comfort food.
It's true.
So that is another reason why people might be getting more breakouts at this time.
But I mean, do you think there's like a minimum or like a maximum you can eat, like to make sure like you don't get like as much, like maybe like one like piece of like dark chocolate a day or something? Like, is there, because I think like it's really hard for us to just stop eating like all comfort food because we want to feel good about ourselves. Like, what's like a balanced way of also including like eating comfort food?
Yeah, wow, it's a really good question. I guess it's all a very individual level, and at this time I think self-discipline is quite a tricky thing. We're now having days where we're not necessarily having the same structure to our days. How disciplined are we? I know I'm a massive night owl, so I'm like my day will most easily shift to my natural rhythm, which will be I'll be more awake at night, and then if my cortisol's sort of eat more sugary foods at night, so I have to be more disciplined with myself. So in terms of how much, I speak to a few of my friends who are nutritionists, and they say a few squares of dark chocolate a day is fine, and they're always about cutting down those low, those high glycemic foods, those white pastas, those white breads. But I can't give you a definitive answer as to how much. We have to like be able to enjoy ourselves and make ourselves feel better. But I think it comes from self-discipline more than anything.
I think like personally, like if I keep eating like bars and bars of chocolates and I keep getting pimples, I mean, like if you don't have any like acne problems, maybe it's fine. But obviously it's important to cut sugar always. So
and it'll be fun to say that skin is it's an indicator of our inner health. So it might be that you've got this flawless skin and you're super lucky, right? That you don't have any breakouts. There's like no break. It will certainly be having an impact on your inner health for sure. If you're just chocolate, sugar, whatever.
Another question we just received is, can Ayurvedic treatment cure adult acne? What are your thoughts on Ayurvedic treatments?
I like this question, actually. Thank you for asking it. It's really interesting. I was pondering on this yesterday as I was watching something that was really slating Ayurvedic medicine and Chinese medicine. And you may know I did quite a bit of yoga teacher training a couple of years ago.
Yeah,
and one of them was in yin, and that's looking at the Chinese and these other methods. So I'm very open-minded to it. I think that there's a lot that we don't know in medicine. And, I think it's important to consider these classical forms of medicine. The problem is that a lot of them aren't science-backed. So it's very difficult for me to advocate things that don't have a strong level of evidence behind them when the rest of my practice is so evidence-based. But what I would say is I do keep an open mind. It depends on the level. Of course, you know, some of those Ayurvedic doctors, you know, they study for 5 years minimum or whatever. Like they have their own medical schools in India. It's extraordinary. And I do know people who have had great improvements. But I would also take it back to what's important is where West meets East. And this is why I love having a conversation with your country, because this is a perfect example of taking into consideration Ayurvedic and other alternative forms, but also bringing it back to where is the other diagnosis. So as I was saying, if there's a hormonal diagnosis, it might be that you're on a medication for depression or other medical reasons that are causing it. So don't just go down the natural form, take consideration of both.
Yeah, a balance is always important.
Yes.
So before I go into a question from here, I want to talk about what's the ideal skincare regimen. So a lot of people ask me about specific products. So this is the question where I want to go into what are the best, ingredients. What is what's a good regimen for the day and for the night. Just product talk.
Okay, shall we do this for ages? For different ages maybe, or do you want to do it with regards to acne in specific?
I think let's do acne in specific.
Yeah.
And then if we have some further questions, we can, always get into that. But I think when we're talking adult acne, we're always also talking anti-aging, because it's always a concern we have in the back of our heads, even if we do have acne,
It's true. It's true. And I have to speak for some of my very severe acne patients and acne scarring patients here. Actually, quite a few of them aren't as concerned about the anti-aging aspect.
Really?
When it is so severe, when it is so debilitating that it affects their social lives, their careers, their relationships so profoundly, actually the aesthetic and the anti-aging aspect becomes less of an issue for them. They just need to have more confidence about having a clearer skin. So
let's talk about a more mild patient.
Yeah. So a more mild patient where you will get some breakouts, as we all do, then I would start with a good cleanser. So the particular types of cleansers that I really like have a good level of alpha and beta hydroxy acids in them. I'm a big fan of salicylic acid. Really big fan of salicylic acid. So even if you don't necessarily have that many breakouts, if there is a chance that you do, and actually the majority of people will still have an oily component to their skin, it is brilliant because it helps to reduce the thickening of the top layer of the skin, the impact within the hair follicle itself. It softens things up. It helps to speed up the clearing of those. So salicylic acid for me is major. And it might be that you want to incorporate that into a cleanser. Now, glycolic acid also has some really great attributes. Not everybody can tolerate glycolic acid well. Some people that do have quite an irritable form of acne, there may be more breakouts with it, but the majority of people using it a few times a week, a glycolic cleanser, is amazing. It gives you that brightness. It gives you that glow that you're looking for. And I think people with cleansers, they just think, oh, it's just something to wash my makeup off or just to wash my skin. But if you actually leave it on the skin, it actually will penetrate better and it will have an impact so that you can get more benefit from it. And, often people ask me about double cleansing. So
yeah, I was actually going to talk about that.
Yeah. So what do I think about that? What do I do personally? What I'll do is I'll remove my makeup or my sunscreen, whatever. I actually use a physical wipe. A lot of people don't. Physical wipe to physically get it off so I can see what's coming
getting off. Yeah.
Because even if I just wash it off first, there's still a lot of straggling, so I like to physically get it off.
So first you do the wipe, then you do the cleanser. Yeah,
I do. Yeah, and I use a very inert type of wipe that you know, isn't inflammatory, that doesn't irritate, and then I'll go to my cleanser. So I use different types. I use a straight salicylic acid one. I've got a glycolic one, and I've got a mix of the two. And then I'll massage it into the skin.
When we're shopping for salicylic acid cleansers, is there like a percentage? Is there like a right one to when we're like looking for one?
Yeah. I don't have it with me, but there's one that I really like for, and it's Bölüm Medical. They do a 2%, and it's a cleansiderm. It's quite strong. That's a really nice one. So I would go up to 2%. And glycolics, I mean, you know, it all depends, but it can be somewhere between 2 to 10%. But what I would say is really go for a reputable brand. And I can put up some links and things for that afterwards. But I really like the SkinCeuticals one. They do a beautiful glycolic cleanser as well, which is really, really good. So I would recommend to, be it if you double cleanse or not, use the second step as the treatment phase of it, and leave it on for a few minutes. So before you get in the shower or whatever, leave it on, and that will help to penetrate better. I don't like my acne patients, be them mild or whatever, using those oil cleansers on their skin or cream cleansers.
Yes.
I don't like any of that residue staying on the skin. So that's what I would prefer.
They prefer gel.
I do prefer gel ones. And if they have a lot of breakouts, I actually wouldn't necessarily recommend to use the wipe either, because the wipe, you don't want to spreading any areas. So I'd rather them double cleanse with one of the other cleansers that we've just mentioned.
Okay. So after cleansing, would you use a toner?
So we have to be careful with the alcoholic content of a toner, because that can irritate and dry and dehydrate. I particularly like this. This is from Zeo. So this is Zeo oil control pads. I work with Dr. Abaji and his team on some of the scientific formulations.
It's a great brand, yeah.
Yeah, I think they're amazing. And I use these twice a day without fail. And they're basically impregnated with salicylic acid, so you don't need to do anything with them. They're amazing. And after cleansing with dry skin, you basically put it over the skin and leave it for a few minutes if you can to evaporate. What that will do is it will help to not just clear out some of those hair follicles and those sebaceous glands, but it will help to tighten the pore. A lot of patients will say that when they use these, even if they don't get breakouts, it tightens the pores. Yeah. And it helps with elasticity of their skin. So for me, I prefer that. With some patients, they can't tolerate that. So I'll go for a more gentle toner. And again, SkinCeuticals make a really nice gentle toner for maybe the slightly more combination drier skin types.
Just a few minutes ago, you actually talked about something really important. You said drying out, products that dry out the skin. So there are some products out there that are made for acne patients, but they have so many, like there's so many like bad types of alcohols in them. So when they use it, it kind of like dries your skin out, and they think, okay, yeah, I'm having great skin, but in the long term, it actually damages their skin. So can you talk a bit about these products that may actually be bad for the skin in the long term?
Yeah, well, nice question. So I guess it comes back to what's going on with the acne. It's what's happening from a scientific perspective. There's a type of fatty acid. So when you look at the top layer of the skin, there's different fatty acids that sit there that contribute to the function and the protection of our skin, as well. And there's one that's really important, and it's called linoleic acid, and that's reduced in acne patients. So because of that bacteria that I was telling you about, that actually has an impact on that particular fatty acid. So those patients will notice that they'll get that good drying out of their skin, but then it will also feel a little bit dry at the
Mm-hmm.
same time. Like it
Yeah.
feels overly dry.
Tight, yeah.
Yeah. So what we need to do is try and rebalance that equilibrium and try and increase that. Now, I wouldn't really suggest my patients to start taking that fatty
Mm-hmm.
acid orally because we probably already get enough of it in our vegetable oils.
Mm-hmm.
Different omegas and things can contain it. But as a topical, there are some products that help to balance that out a little bit. So
Mm-hmm.
back to the question, what would I say with my patients that are breaking out?
Yeah.
I would say I do like to dry them out more than make them dewy. So a lot of the patients will be like, oh, but I still want to look dewy and I still want to look healthy. But some of those products that make you look dewy will be stimulating the oil more. Mm-hmm. So in the first phase, I really like to, really very much so, I will go on the salicylics. Great, a tretinoin, we'll get onto that.
Yes, definitely.
Yeah, we'll get onto the vitamin A. But I would do that for the first 6 to 8 weeks. So the skin cycles once every 6 weeks, and try and get it stable. You can start to add in other products. There's one I really like. This one is, oh, I don't know if you can see it. It's called SkinCeuticals Blemish and Age.
Yes.
Keep it in the box because you know, we don't want oxidization of products. You know, it's really nice with all these things to like keep the bottles out, but keep them in the box because then it will last longer for you. This is really great for patients who still get breakouts. And just if they've got that combination skin. So this has got a type of salicylic acid in it. I think there's about 1.5% in it. And then there's another form of salicylic acid in it. And they've got some other breakdowns of acids which help with the actual physical breakouts. But it's also really good from an anti-aging perspective. So for your type of patient saying, it's oh, but I'm really worried about the anti-aging aspect, then I would go for blemish and age. So I would probably say the glycolic cleanse and go for blemish and age. That will then treat both as concerns.
So before we go into vitamin A and serums, let's talk a bit moisture. How important is it for us to have like really well moisturized skin if we're dealing with adult acne?
It's not that important.
That's a good point.
Yeah. So a lot of people ask me about moisturizers and points on this. Some top dermatologists will say you never need a moisturizer again in your life. Others will say you've got to keep moisturizing. I said it depends on the patient that sat in front of me. So the dry skin types, yes, they will need a moisturizer potentially, and one that is active. So like a hyaluronic acid is a really good option. A topical hyaluronic acid that actually is active. You know, this all depends on the formulations, of course, because there's a lot of products that just do not penetrate. But when it comes to acne patients, it's less relevant. And that's why I was talking about the LA, you know, that type of acid, that fatty acid. It's actually that's important, not just blindly moisturizing. So if those patients are struggling, you could consider an HA topical, so a hyaluronic acid topical. Again, you know, if you're looking for a product, SkinCeuticals make a really nice one, HA intensifier.
So a serum, like you would prefer a serum, not like a cream. Definitely in terms of texture.
Definitely not a cream. So for the first 8 weeks, definitely not. And then consider after that maybe an HA intensifier, something that has. The other great product is something called triple lipid. You can use it very sparingly at night once the acne is under control, and particularly if you're going to bring in a vitamin A, because that has the ceramides and the free fatty acids that your skin needs.
And I feel like some of the patients, some of the people have issues with their T-zones only. So their cheeks will be getting dry, but their T-zones will be oily. So is it okay to just on the T-zone?
Yeah. This is actually a very classical question. You can do that. You can do that. There have been studies to show that actually there can be lots of different areas of the face that can come up depending on the hormones and the stressors and the diet. So it might be that you just seem to think that you just get T-zone, but just be mindful that if you are overly moisturizing the cheeks into those breakouts, your sebaceous glands are already a little bit overactive, and it can develop in other areas, you know. So you can do that, but I would just be mindful and watch carefully how your skin's behaving throughout.
So from what you're saying, honestly, I feel like a lot of people are breaking out, maybe not just because of stress or what they're eating, but I feel like it's because of they're using the wrong products. They're like products that are not suitable for their skins, or they're mixing the wrong products with like other wrong products. I mean, it's not easy to, you know, get the right balance.
You know, it is not easy. And you, as a beauty director for all those years, and, you know, as a beauty specialist, you know, beauty journalists, beauty editors are some of the most difficult people to treat, because you get sent a whole lot of, you get all the right new things off the market. Your skin is like constantly being bombarded with different things, you know, and it can be really, really difficult. And that's for somebody who's so well informed. So for the general public, who, it's great that we have all this information out there now, right? I'm a big advocate of people being empowered through education, but it's got to be the right information. It's got to be scientifically based and evidence based. And it is an absolute minefield for people, because how are they meant to know? You know, you do go to trusted sources, but how trusted are they? You know, are they medical? It's really hard. Yeah. And it's very tempting to really mix and match a lot of things. So, you know, I would always say research a good doctor, you know, a good doctor that has a good medical team, and go and get a consultation. You know, it's like
perhaps take your products to the dermatologist, to the doctor. I think that's just like the right way to do it, to see where you've gone wrong, right?
Yeah, it's fascinating. And then you see like the patients, and they'll come in, they'll be like, oh my God. And they'll like put out all these things. And I'm like, this is crazy. You're putting like something to try and make your skin dewy. So you're putting foundation on, but then you're using something that's just like totally stripping your skin and then making more oil. I'm like, oh man. So we have to kind of, yeah, really
begin again.
And actually a lot of my patients have to go cold turkey, but you know, they've got to be wicked. You know, it's like, just stop all of it. That aren't too aligned to a certain, you know, they're not too attached to it, and then we can really, you know, start again.
You know, actually, you just said that. I mean, it's I mean, I receive so many products, and I'm, you know, in close contact with all of these cosmetics companies, and you know, I know these people, so I want to trust these people, and I want to try the products, so I show, you know, my followers and my friends, you know, it's like, even sometimes, you know, I make mistakes. You know, it's not easy. So like, you're making mistakes, even if you're like in this business, like, it's fine. It's okay. It's so complicated, really. Like,
absolutely right. It's so complicated. And you know, how do we teach? You know, I think we have a responsibility, actually, Valerie, you know, people like you and I, where we come together to actually help educate people so that they can be more discerning with their choices, so they can actually, you know, step back and think, actually, that's not what I heard. You know, I heard something different, and kind of sit back, give it some consideration just before sort of pressing buy, or, you know, it's so easy as well, like in the beauty halls, to get really into all of that, isn't it?
Yeah.
Like, oh, of course I need all of that, and yes, I need the serum, and I need the eye cream. Like, do you?
Yeah. It's, I think, one thing, if you're like a big beauty lover, just be as skeptical as you can be.
Yeah,
you know,
good word.
And learn how to.
Yeah, the labels are one thing, but I think it's coming back to, you know, people like yourself giving out great education to your followers, and then that will spread, and hopefully there will, you know, your followers will go and see good doctors, and I'm sure that will be then well managed for them, because it's a long-term journey, and things change with our skin constantly.
It's true.
We need to be adaptable with it.
It's true. So before we get into some scarring issues, let's talk about retinol. Let's talk about vitamin A.
Okay.
How can it be used to treat adult acne? I've actually used Roacutan as a 14-year-old. Yeah, I used to have lots of acne, and I still have some redness here. So actually, talking about some redness and like really interesting for me. But how can we use vitamin A as an adult topically?
Okay, so vitamin A comes in different forms and different derivatives. So you may have heard of retinol, tretinoin, obviously Roaccutane. Accutane is an isotretinoin. So they're all derivatives of vitamin A, but they're different formulations. They're different chemical compounds, and they behave differently. So if you've got like a mild form of very, very mild, you get some blackheads, a few whiteheads, some breakouts, but you're interested in anti-aging, then consider retinol, and consider retinol early. So retinol.
What percentage?
So I would consider 0.3% to start with if you've got very little breakout. So I like this one. Can you see it? It's Skin.
Yeah.
There you go. It's SkinCeuticals 0.3%. They do a great step-up range. Are you familiar with it? Because a lot of retinols will either, the way they're formulated, either will not be active or not that active relatively, or they feel very overwhelming. Then people think they're reacting to them, they're irritable, they're red, they think they're getting a side effect. So they stop using it. So their compliance with the then stops. The reason why I like the 0.3%, if you've never used a retinol before, is because you're much less likely to have all that irritability. So you're more likely to then build the benefits to it. So how it works is it helps to clear out the hair follicle. It helps.
So we go back to the beginning of the
all back. So that's what it's making that process much more efficient. So it will help with the comedones, the whiteheads, the blackheads, the breakouts, and it will also be very powerful from an anti-aging perspective for your followers. So it's it's seen as a fundamental cornerstone of anti-aging because it helps with pigmentation, wrinkles, it helps to thicken the dermis, so the fundamental layer of the skin. So it's a really, really great product for those patients that have some breakouts and are thinking about anti-aging. Next product, this is what I'm using at the moment. I was on 0.3%, I went up to 1%, and I was starting to get some breakouts, and from time to time, when I've been out walking, so I've started 0.1% tretinoin.
Okay.
And this is the Abaji medical version. This behaves quite differently. So jumping from something like that to that is a big jump. You use a very, very tiny amount, and you use it all over the skin. It will help with the pigment and the breakouts. It's really good for patients that have more active forms of acne.
So this product you would suggest for more severe acne?
Yeah, and of course, when it comes to severe acne, like I've said, it's multifactorial. Yes, we've got the diet and the health aspects, but there's medical aspects that need to be ruled out. So there's usually something underlying with regards to hormones that need to be regulated. It's so important that people remember that. So one particular product isn't going to fix it.
Okay.
You have to look at it from a global sense and think what you're putting on the skin as well. So they're both really, really great options. With any form of retinol, with any form of tretinoin, you will get some degree of peeling. Exactly. And how do you communicate that? Because a lot of people will be like, no, I'm peeling and it's not good. It's like, well, that's kind of what's happening. That's what's meant.
You're getting your new skin. You're getting like new skin from like under the dead cells. Yeah.
And now's a really great time, Valerie, to be doing this. This is what I wanted to be talking about with patients because nobody's really seeing us. So get the retinol out, invest in a good retinol, like I said, in the Step Up program with that range. It's brilliant. It's a great time to get on top of your skin. You will notice a change in your skin within 1 to 2 weeks, and you'll see that the pore size is reduced. You might see a reduction in pigmentation, smoothing, just with a low dose of retinol alone. So
1 to
really,
2 weeks is a really short amount of time to get like the results. So it's very important. Yeah,
you can see it for sure.
I also want to talk about, scarring.
Yes.
What are some like topical things we can do to treat scarring and the redness? Because you have sometimes like these like red shadows that are left behind all the treatments of the past. And I know that you do also some like physical treatments in your clinic. Yeah.
Most definitely. And so of course we've got to prevent. So all the things we've already talked about. One of the really powerful things, I don't know if there's the people in your country that use it, and it's called TheraClear. It's a machine that I have in my practice. And for people that do have breakouts, it combines a broad spectrum light with a vacuum. So it actually helps to reduce the breakouts. So if we're reducing the breakouts, we're then getting on top of scarring quicker. So that's something to consider is TheraClear. And the early phases of the scarring are critical. So top tip would be, please don't pick at the skin.
Yeah, I was gonna say that's what my mom would like tell me when I was in puberty. Just if you do it, then you'll get scars.
Yeah, not eligible scar. If you're lucky, if you don't, right? So if you have a very simple, very beautiful skin type that doesn't scar, you're lucky. But with a lot of patients that have maybe a mixed skin type or a different ethnicity, they pigment easily, there's redness, yeah, for sure, you are increasing your risk of scarring. And, there were certain patients, actually, I did a lot of studies of this before I even went into aesthetics on scarring, Valerie. And there were some patients that will have redness in their scars for about 18 months. So it will go red and then it will start to subside and it will go white. And then there are other patients that will stay red forever. And if you've still got
for
some
me,
redness,
it stays pink forever. So
yeah, there are certain genetic patients like that who will stay red for a long, long time. And so we have to catch it really, really early. So by using something like a TheraClear or whatever to treat the topicals, and then what do we do with the scar itself? I use something called Coat. I don't have it with me, but it's a silicone based. So it's a very, very minute, very fine gel, and scars respond well to pressure. So you apply the silicone gel, very, very minute amount, because if you're still getting breakouts around the area, then it can, you're still going to get some inflammation. You apply it to the area. I really like Coat because it's got a UV block in it. So that's helping to prevent the scar from staying red from the UVB. And of course, the collagen breakdown around the scar. So that's something that you could consider getting at home. I really like that product. The tretinoin. So the tretinoin is really good for scars. So if you're using that for the breakouts themselves and to prevent further, it's great for treating scars. So even if you feel you've got burnt out acne and you're watching and you've still got acne scarring, consider either retinol or tretinoin for a powerful way to improve your scars. So that's a way of looking at it at home. Then the other thing would be an antioxidant. So if we think about the scar, we need to support the scar from around it from a collagen and an elastin perspective. And the way to protect our collagen and elastin is to use a topical antioxidant. So there's some great ones out there, vitamin C derivative ones. They need to be active. We can talk about that another time.
Yeah,
so,
that's a whole different
that's
topic.
another different subject to consider. And then in terms of treatments, there's lots of different treatments. A lot of people say to me, what about laser? Everybody always goes to like a laser as a first go-to. It depends on skin type. So when I mean skin type, if you're somebody who's more likely to pigment, if you have a mixed skin type or a darker skin type, you have to be really careful. You have to have a patch test because you may not pigment or scar to start with, but you can get something called post-inflammatory hyperpigmentation, where it goes red afterwards, it then darkens, and it actually can leave you worse off than the scar itself. So this has to be very carefully managed. Don't just go to anybody for the acne scarring. You can use laser, depending on the depth of the scar. You can use a chemical peel, but both of those modalities will only get to a certain depth within the skin and up to a certain point. And depending on the scar types, you know, you have like ones that are like this, rolling ones, box ones that are like this, ice pick ones. We need to go deeper. So a lot of the things like I've shown to you in the presentation that I did last year, I use a combination of different things. So I like to use injectable hyaluronic acid. So it's not really using it as a dermal filler, but things like Juvederm Volite to actually lift up the scar, inject back the hyaluronic acid directly to the scar, and then use something called subcision, where I kind of dissect away the attachments of the deeper aspects of the scar, and it lifts it up. So you do
a more in-depth treatment. That's why it works.
Yeah, so there's different combinations that I'll use. In some patients, I might use a peel, but quite often with a deep, we'll go to my injectable hyaluronic acid, I'll use precision, and I'll start to smoothen it out. My acne scarring patients are really close to my heart. I have thousands of acne scarring patients, and they've tried everything. They've tried every laser, they've tried Fractal, they've tried everything, and they're still there. They want a fast result. And by doing that process, I can get them a quicker result. I can actually get them a result on the bed. And for them, that's life-changing. So that's super important,
And I want to talk just quickly about some at-home hacks we can do when we have like a sudden breakout. Like, do you have like a natural solution that we can try at home if we don't have access to all these amazing products, you know?
I don't. I mean, I know that's not really very helpful.
No, I mean, if there's nothing, then there's nothing, you know?
I would rather go back to what's causing it. So rather than getting things out the fridge and just thinking, right, I've got this, I'm going to just start putting it on, it can aggravate it. It can cause the glandular areas within the hair follicle to be more irritated. It can make the situation much worse. I'd rather you just leave it, not pick at it, and just leave it. If you do have like some of these products that I've mentioned, like the salicylic acid based ones at home, put that on it. Like the Blemish and Age or a retinol, you can pop a bit of retinol on, and that will help to just settle it down a little bit more. But think about your stress levels and your diet.
So go back to the reason instead of trying to put like weird natural things that might make it worse, you know?
Please.
So we have a question here. Sanam says, what are your thoughts on high frequency glass tools for antibacterial use?
Oh yeah, thank you. She did ask me that question when I put that out, and I wasn't actually sure what you meant. I think it was that, did you mean those, do you mean for like hair brushes, for makeup brushes, to wash them? I'm not sure what she means.
Okay, we can get back to that when she elaborates.
Yeah, if it is that you mean, I've not personally used those. I see them in they like do a centrifuge system, right? You might have used them, Valerie. I mean, you've probably been sent one. I don't know. I haven't used it. I just go back to basics with my makeup tools. I actually use my acne cleansers because I just, to make things clear, I always use an acne cleanser.
Okay. Even if you don't break out.
Always. Irrelevant of where I am in the world, what season we're in, what time of the month it is, I always use an acne cleanser.
That's an amazing tip.
And I always use my oil control pads without fail. So I'll use those to wash my brushes.
That's smart. Yeah, that's smart. That's a really, really good tip. Thank you.
So I can't really comment on those centrifuges.
So we have about 5 minutes, and I want to talk about something you do in your clinic, self-confidence treatments, because I think self-confidence is such a big part of the acne treatment process itself. Don't you agree?
I absolutely do. And I feel fortunate in my practice that, as I said, I've had many patients in years. I've had thousands of either active acne or acne scarring patients. And in particular, there's a lot of acne scarring patients.
Mm-hmm.
And I have people who barely leave the house. It's really, really impacted their relationships, their social life, their progression in life.
Mm-hmm.
So as somebody who's looked after them for a long time, I was like, you know, I can't just be treating the outside. I try and psychologically support them. So for many years, I think I was one of the first aesthetic clinics in the UK to actually bring in a psychologist. So not just for my acne patients, but for anyone who's dealing with either facial scarring, trauma, or obviously dysmorphia type issues.
Mm-hmm.
And now it's spread so that a couple of years ago, I opened up a developmental studio in my practice where we offer meditation, we offer life coaching, happiness coaching, self-confidence sessions. So it's not really a yoga studio as such. It is in the definition of yoga, but it's about self-development and where that comes from. You know, it comes from self-confidence, that confidence from within, that acceptance of ourselves, but still whilst wanting to improve ourselves. And that is a very, very complex equilibrium, isn't it?
It's a very tough balance.
It is. And so, you know, my patients, I have to say my scar patients, my acne scar patients, my trauma, my disfigurement patients were my muse. They inspired me a lot in that process to bring in a lot of those parts of my practice where I knew that people needed support. And it's not just them, it's all of us. We all want to be working on that in different forms or not, depending on where we are in our lives.
That's very true. I agree completely. And I think like that's all my questions, Dr. Chantrey. Do you have like something we haven't covered?
No, I think just as a synopsis. So I think I'd like to just do a wrap up actually, because I think we've covered a lot of different aspects. They've been very medically based, your questions, so thank you, Valerie. I wouldn't expect anything less, of course. So, you know, we might have mild, moderate, severe. There's different forms, there's different types. Remember that our immunity plays an important part, our hormones. So there are different factors at play. Have a really good think about what else is happening with your body, both women and men. Try and track it, make a diary of what's happening with your skin, and you might be able to link it. Remember, there is good evidence, very strong evidence, that stress, in terms of substance P and diet, high glycemic and dairies, all increase insulin, which then has an impact on the sebaceous gland. So please remember diet, stress, and of course the topicals, all of the topicals that we've discussed. You want to be thinking about retinol, salicylic acid, glycolic acid, and like I said, linoleic acid is the key. Don't just blindly moisturize your skin.
Amazing. Thank you so much. And my friend actually just wrote right now, I mean, the high frequency electrotherapy through the glass electrode tube, which is available on Amazon. I don't know if you know it.
I actually don't. I'll take a look at it for you. And,
okay. Thank you so much, everyone, for watching us, and thank you, Dr. Chantrey, for joining us with this amazing information. This is going to be so helpful for a lot of people, I'm sure.
It's my pleasure, Valerie, and I put them together. And I love coming to Turkey and working in Turkey.
Sure, after the pandemic, a lot of acne and acne scarring patients will want to come to Manchester to visit your clinic.
Well, I speak in Turkey quite often, so it's always nice. Thank you so much, Valerie.
Thank you. Thank you, everyone, for watching, and I'll see you guys later.